Hi, I'm Thomas. I'm going to talk about low back pain. We'll be looking at the definition and the causes. What is low back pain? Low back pain is a pain that is felt at the lumbar region. Low back pain is a common cause for visits to the doctor in Ghana and other countries. According to the National Institute of Neurological Disorders and Stroke, NINDS, low back pain is the most common cause of job-related disability. At least 80% of Americans will experience low back pain in their lifetime. Most low back pain is the result of an injury such as muscle sprains and strains due to sudden movements or poor body mechanics whilst lifting heavy objects. Low back pain can also be the result of certain diseases such as a ruptured or herniated disc, sciatica, cancer of the spinal cord, arthritis, infections of the spine, and kidney infections. Acute low back pain can last anywhere from a few days to a few weeks, while chronic pain is pain that lasts longer than 3 months. Now, low back pain is most likely to occur in individuals between the ages of 30 and 50. This is partly due to the changes that occur in the body with aging. As we grow older, there is a reduction in the fluid content between the vertebrae in the spine. This means discs in the spine experience irritation more easily. You also lose some muscle tone, which makes the back more prone to injury. This is why strengthening your back muscles and using good body mechanics are helpful in preventing low back pain. What are the causes of low back pain? One, strains. The muscles and ligaments in the back can stretch or tear due to excess activity. Symptoms include pain and stiffness in the lower back, as well as muscle spasms. Rest and physical therapy are remedies for these symptoms. 2. Disc injury. The discs in the back are prone to injury. This risk increases with age. The outside of the disc can tear or herniate. A herniated disc, which is also known as slipped or ruptured disc, occurs when the cartilage surrounding the disc pushes against the spinal cord or nerve roots. The cushion that sits between the spinal cord extends outside its normal position. This can result in compression of the nerve roots as it extends and exits from the spinal cord and through the vertebral bones. Disc injury usually occurs suddenly after lifting something or twisting the back. Unlike the back strain, pain from a disc injury usually lasts for more than 72 hours. 3. Sciatica. Sciatica can occur with a herniated disc if the disc presses the sciatic nerve. The sciatic nerve connects the spine to the legs. As a result, sciatica can cause pain in the legs and feet. This pain usually feels like burning or pins and needles. Fourth one is spinal stenosis. Now, the spinal stenosis is when the spinal column narrows, putting pressure on the spinal cord and spinal nerves. Spinal stenosis is most commonly due to degeneration of the disc between the vertebrae. The result is compression of the nerve roots and spinal cord by bony spurs or soft tissues such as discs. Pressure on the spinal nerves causes symptoms such as numbness, cramping, weakness. Now the fifth one is abnormal curvatures in the spine. Scoliosis, kyphosis, lordosis are all conditions that cause abnormal curvatures in the spine. Now these conditions are mostly congenital conditions that are usually first diagnosed during childhood or adolescence. The abnormal curvature causes pain and poor posture because it places pressure on the muscles, tendons, ligaments, and vertebrae. Now note that the following conditions I'm going to talk about can equally cause low back pain in some people. The first one is arthritis. Arthritis is an inflammation of the joints. So in the case of low back pain, it can be an inflammation of the spine, that is the vertebral bones. There is a joint in the vertebral bone, so if the joint is inflamed, that is what is called arthritis. Now the second one is fibromyalgia. This is a long-term pain and tenderness in the joints, muscles, and tendons. The third one is spondylitis. This is an inflammation of the joints between the spinal bones. Viewer, thank you very much for your time. I would respectfully suggest that you also look out for the exercises that one can perform when he or she has low back pain on this very channel. And I will plead on your behalf that if you are a new subscriber, kindly tap on the subscribe button and move with us. Thank you. Have a nice day. Bye.